What's the difference between stress and anxiety? Is all anxiety problematic? Hi, I'm Dr. Richa Bhatia, a board-certified psychiatrist with about 15 years of clinical experience. Today, let's unpack these questions. Anxiety generally involves worry about a future potential threat, something that hasn't happened, or future possibility of harm. It may involve a persistent worry or dread that something could go wrong. Whereas stress is the body's physiological response to an external event that has happened or is happening, for example, a deadline, exams, or overwhelming job pressures. Stress tends to go away after the stress-inducing event has resolved, whereas anxiety tends to persist even after the event is over. Both stress and anxiety can cause physical symptoms, for example, a fast heartbeat, GI distress, and exhaustion. So sometimes it can be hard to distinguish between them. Stress can be acute or chronic. Acute stress may last for a day or a few days, whereas chronic stress can last for weeks or months. The body is not designed to stay in a prolonged state of chronic stress. When the stress-inducing event doesn't resolve or it persists, chronic stress might develop. What are some of the signs of chronic stress? Chronic stress can show up in the form of sleep difficulty, aches and pains, headaches, low energy, and mood changes. Chronic stress can have a detrimental impact on cardiovascular functioning, increasing risk of high blood pressure, increasing risk of chronic inflammation, obesity, and it can negatively impact the immune system. Therefore, it's important to consult with your primary care doctor if you believe you're suffering from chronic stress. The good news is that mild anxiety and mild stress can get better with physical activity, social connection, healthy nutrition, getting enough sleep, and mindfulness practices. What's mindfulness? Mindfulness involves cultivating the practice of being in the present moment in a non-judgmental way, noticing thoughts, feelings, or physical sensations that are arising without judging them. It often also involves diaphragmatic breathing. Studies have shown changes in brain waves with mindfulness, for example, increase in alpha waves, which are generally associated with relaxation. Guided mindfulness exercises can be one of the ways to get started with mindfulness. I'll share the links of some guided mindfulness audio exercises in the description. Now, when does anxiety become problematic? Not all anxiety is problematic. Some amount of anxiety may even be helpful for optimal functioning. For example, when preparing for a test. Anxiety can become a problem when it starts interfering significantly with functioning in one or more areas of life, or when it's difficult to control, or if it's causing significant distress. Psychotherapy is generally considered a first-line treatment for mild to moderate anxiety. Psychotherapy can help understand the roots of anxiety, it can help put things in perspective, and it can lower the severity of anxiety. Studies show that psychotherapy can lead to positive functional brain changes. This video is for general education purposes only. This is not medical advice, and this should not be used for diagnostic or treatment purposes. For advice regarding your health, please consult with your primary care doctor or specialist for guidance. Take good care.